Hello, my name is Dr. Clooney. You have received this kit because you had reported to the FluBGon Trial Center that you were experiencing flu symptoms in the last 24 hours and that you're interested in participating in the FluBGon trial. Thank you for your interest. I would like to start by explaining the trial to you as well as describing the contents of the patient kit you just received. You've expressed interest in participating in a research study, also known as a clinical trial for the treatment of influenza, commonly called the flu. The point of this research study is to determine how well a new medicine known as flucetvimir, or FluBGon, works and how safe it is in treating influenza in subjects with weak immunity. Let's start by explaining the purpose of each item in your patient kit. You should have the following items in your kit. Please call the trial center if you're missing anything. Your iPad, the Scan-A-Flu device, the BioWatch, the electronic stethoscope, the electronic otoscope, the data transmitter, the blood sample kit. Your iPad will help you navigate through the trial. It will provide you study details, how to use various tools, and obtain your consent to participate in the trial. It will send you reminders for your upcoming trial visit and when to take the study drug. Every day, the iPad will also prompt you to answer a few questions on how you're feeling. It will even help you video conference with me or a member of my staff in the comfort of your own home or at your primary care doctor's clinic. The Scan-A-Flu device is a simple diagnostic tool that will use your saliva to determine if you are infected with the influenza virus. If you agree to take the Scan-A-Flu test, you're not committing yourself to the entire research study. If your Scan-A-Flu test is positive and you consent to participate in the study, we will ask you to schedule a visit with your community doctor to conduct a physical exam and blood tests to ensure eligibility for the study. If you are too ill to make the visit to your doctor, we will send a mobile nurse who will conduct the exam under my oversight via a video visit. Should you choose to participate in the study, the BioWatch will allow me to monitor your vital signs remotely, as well as track your movement to assess if and how quickly FluBGon is helping you return to your normal activities. If I need to examine you virtually via your iPad, the electronic stethoscope will help me listen to your chest remotely. The electronic otoscope will help me examine your ears remotely. Finally, the data transmitter should be plugged into an outlet that you will walk by every day. It will wirelessly transmit your data from your BioWatch to the trial center, as well as show your data on the iPad. It is important to keep this plugged in at all times. Now let's switch to talking about what you can expect to experience in the research study. If you qualify for the study, a shipment of FluBGon will arrive at your home within 24 hours. FluBGon should be taken once a day for 11 days. On the first day, we will observe you either by video or a mobile nurse for 1 hour to ensure you have no allergic reactions. Today, day 1, you'll be instructed how to enter information into the iPad, use your biosensor watch, and treatment administration details, including the time of each FluBGon dose. At each visit, 2 nasal swabs and 1 throat swab will be taken by a visiting mobile nurse or your community doctor. On days 6, 8, and 11, we will also collect blood samples every 30 minutes for 8 hours after you take FluBGon. The blood samples will measure how much FluBGon is in your blood and compare it to how you are responding to the treatment. Be assured the blood samples are very small. A total of 8 milliliters of blood, half a tablespoon, will be taken if you consent to participate in this part of the study. Now, you can still participate in the study if you do not want blood samples taken. Your daily responses to text questions will be reviewed, and you will be questioned about any symptoms not reported in the diary and other medications you may be taking at each scheduled visit. Treatment will end on day 11. The assessments performed on day 11 are similar to those performed at the baseline visit. A Scan-A-Flu test for the detection of influenza virus will be performed. A physical exam and vital signs will be taken via telemedicine visit with the mobile nurse and myself. 2 nasal and 1 throat swabs will be collected. Blood will be drawn for safety labs, and a urine pregnancy test will be performed if I deem it necessary. If you or your doctor decide to stop treatment early, an end of treatment assessment will be performed at that time. Even though you've completed your course of FluBGon, we will continue to collect data. A mobile nurse will visit you again on day 15 to collect nasal and throat swabs. The nurse will also collect your vitals, review e-diary data, and record any other symptoms that you're experiencing. If you decide not to participate in the study, we encourage you to seek treatment from your community doctor. If you are still interested in participating, please give your consent to administer the ScannaFlu test via digital thumbprint on your iPad. Based on the results, we can determine if you qualify to continue in the study.